We roughly carry out about 200 investigations of heart and lung problems a month, and we've got about 300 patients with pacemakers in the GHA at the moment, and about 400 patients that have sleep disordered breathing, CPAP users, and we do 3 cardiology clinics a week, and we do stress testing sessions, pacemaker clinics, lung function clinics. We're very busy. There is a lot of heart disease in Gibraltar.
Well, hypertension can be a disease, I should say 50% of the time, but some other times it's just a sign of alarm. Things with your lifestyle are wrong.
A lot of young cases, we have patients in their 30s getting MIs here, so there is a problem here.
We've had quite a big influx of patients ranging between the ages of 20 to 30-year-olds coming through with a wide variety of cardiac conditions like heart attacks, requiring open heart surgery, stenting, which is quite alarming.
The main issue here is probably smoking and maybe some binge drinking as well, poor dietary choices, and just being inactive.
Smoking is a heavy metal problem. People sometimes do not realize what's the problem, why smoking blocks arteries. It's a heavy metal problem. When you inhale smoke, you are inhaling cadmium and arsenic that are very toxic heavy metals that blocks your artery. It's not always a problem of cholesterol and diabetes and so on. They are very well-known risk factors, but there are other risk factors, are these heavy metals that are devastating, not only for the arteries, also for prostate cancer, dementia, COPD, for example.
Facilities have been a little bit thin on the ground up till this point in time. We have a firm commitment from government that these things were going to be improved in the future.
It is an issue which our members feel strongly about, that it should improve, specifically the cardiac rehabilitation. It's a department that we feel which is basically our first stop shop for our members. So yes, I would say that cardiac rehabilitation is our number one concern at the moment.
Ideally, if we had our own cath lab where we can carry out our own angioplasties and stenting, and patients wouldn't have to travel for those, urgent sometimes referrals, and that would be ideal.